NCLEX review on neurological system. And now let's start with seizure. The abnormal activity in the brain which causes change in the behavior, movement and consciousness is known as seizure. This can happen throughout the brain, affecting both sides. Generalized seizure or being located in a specific area of the brain, which is known as partial or focal seizure. And the progressive condition of the seizure is known as epilepsy. Epilepsy is a condition when patients have frequent seizure. Seizure can occur in anyone, children or adult, due to a severe acute condition such as high fever, illness, hypoglycemia, acid-base imbalance, alcohol withdrawal, brain tumor, CNS infections like meningitis, etc. Among the generalized and partial seizure, the generalized seizure is again divided into 5 types. The first one is tonic-clonic or grand mal type seizure, and this is the most common type where patient experience aura, patient loss consciousness, and there is risk of injury. Patient will experience a tonic phase where body stiffness occur, may bite the tongue, breathing may stop followed by cyanosis. Then a clonic phase, there is recurrent jerking movement, spasm and relaxation back to back of extremities. Patient may have incontinence of stool or urine. This phase usually lasts no more than 3 minutes, and there is risk for status epilepticus with this type of seizure. If greater than 5 minutes or having multiple seizures in a row, activate emergency response team will need immediate treatment to stop seizure. And the second type of generalized seizure is either tonic seizure or clonic seizure. In case of tonic seizure, there will be stiffening of the body, there is risk of fall, and if clonic seizure occur, there will be jogging movement, can be asymmetrical or symmetrical. And the third one is absence seizure, which is also known as petit mal. This is the most common in pediatric patient, and hallmark is a stating like state. And the fourth one is atonic seizure, which is also known as drop attack. There is no muscle tone. Patient may fall if standing, slumps over if sitting, risks of head injury. And the fifth one is myoclonic seizure. There is quick duration of jogging of the muscle. Patient usually aware and conscious and lasts in a few seconds. And knowing these topics are important for the NCLEX exam, and I have included the topic you need to study for the NCLEX. Now let's go on stage of seizure. The first one is prodromal, when symptoms start to appear prior to the big event like seizure. And the second stage is aura, which does not happen with all type. This happens at the very beginning of the seizure. Many times it gives the patient time to prepare self for seizure. As the nurse, if you are virgin, help the patient lay down onto their side with a pillow under the head. And the third stage is ictus, which word means seizure, and this is the actual seizure stage. Usually lasts anywhere from 1 to 3 minutes. If greater than 5 minutes or if the patient starts having seizure back to back, the patient may be experiencing status epilepticus, will need medical care, and medication is needed to stop the seizure. Now the last one, fourth phase, is post-ictus or post-seizure phase. In this phase, the brain is going to rest and recover from the seizure, usually lasts out 2 days, and the patient may feel extremely tired, sleepy, confused, and headache. Now let's go on nursing interventions for the patient with seizure. And this is the most important part for your NCLEX. You must have the idea how to manage the patient with seizure. If you found patient with seizure, you have to provide the safe position by lying on their side, remove objects that can cause injury, remove restrictive clothing or any items. For the patient with seizure, at the bedside have suction and oxygen ready, must maintain the patent IV access, padded side rails and pillow under the head, oxygen readiness, bed in the lowest position, do not restrain to the patient, do not put anything on the mouth, note the time it is started and stopped plus patient behavior right before, during and after, urine stool incontinence or cyanosis, immediately notify if seizure lasts more than 5 minutes, which is status epilepticus. This term is most important for the NCLEX. In this case, we need immediate medical management. And the final one is medication and treatment. For the medical management, we use barbiturates, phenobarbital for tonic-clonic, focal or status epilepticus. Hydantoins are also used like phenytoin. The NCLEX tip to know is the phenytoin side effect. This causes gingival hyperplasia. Also watch platelets and WBC count because this medication also causes bone marrow suppression. And the next side effect is Stevens-Johnson syndrome. Tell patient to report immediately if any sign of Stevens-Johnson syndrome. And avoid milk and antacid with this medication because it delays the absorption. Benzodiazepines are also used like diazepam or lorazepam. It may lead status epilepticus because of fast acting. In such case, reversal agent flumazenil may be used. And the another medication used in seizure is valproates like valproic acid. This is used in all type of seizure but monitor liver, WBC and platelet or GI issues. For the surgical management, surgery is done to remove an area of the brain that is causing seizure. For example, focal seizure arise from temporal lobe. Lobectomy may be performed to remove the temporal lobe. When medication is not working, placement of a vagus nerve stimulator is done. Ketogenic diet is given in pediatric patients who have epilepsy. This is high fat, low carb diet. Now let's go on next topic, that is multiple sclerosis. It's an autoimmune disease that affects the myelin sheath of the central nervous system. This leads to inflammation and scarring of the nerve, which causes a decrease in nerve transmission. Exact cause is not totally known, and this tends to occur more in women than men. There is currently no cure, but there are lifestyle changes and medications that can improve signs and symptoms. Patients with multiple sclerosis feel sensational issues like voluntary tremor, spasm, numbness, tingling, emotionally drained, fatigue, weak, swallowing issues, speech issues, mood swings, unable to aware of one body position, vision problems like nystagmus, issues with controlling eye movement, double vision, blurry vision, painful while moving eyes, elimination problem because the nerves are affected that control the bowel and bladder. Patient may feel either constipation or diarrhea, and in this condition the symptoms get worse with heat and physical activity. This is the tip you must know for the NCLEX on this topic. Now let's go on nursing consideration or interventions for the patient with multiple sclerosis. Focus on patient safety because they have vision coordination, decreased perception with pain. We should prevent from symptoms worsening, bladder, bowel issues, and timely administration of medication. It is important to maintain regular exercise as tolerated, not too much because it can exacerbate the symptoms. Use assistive devices to help with walking and preventing injury. When symptoms are presenting, clutter-free environment, especially when vision affected or experiencing vertigo. We can provide support groups with others who have MS. Make accessibility to bathroom easy due to overactive bladder or problem with retaining urine. Provide plenty of fluids to prevent stasis of urine and to keep it from becoming too concentrated. High fiber diet or stool softeners in case of constipation. As patients have neurological problem, we need to regular evaluation of neurological function of the patient, assess for coping strategies and psychological function. We need to provide adequate psychological support plus family education, help to identify patient need and fulfill them. Okay, let's go on medications. The medications for the multiple sclerosis depend upon the symptoms. There is no cure for disease, but the medical management is done as per symptoms. Corticosteroids are used to relapse the symptoms. Muscle relaxants are used like baclofen for muscle spasm, gabapentin or pregabalin for pain, amantadine for fatigue, antidepressant, cholinergic medicine for overactive bladder like oxybutynin, physical therapy and rehabilitation, lifestyle modifications like healthy diet, sleep, hygiene, etc. And the another topic in neuro disease is Parkinson's disease, which is progressive neurodegenerative disease, primarily affects to the movement. Parkinson's disease tends to occur in older age, 60 plus. There is no cure. There are medications to relieve signs and symptoms. Normally, in the nervous system, there is a balance between acetylcholine and dopamine. Acetylcholine is an excitatory neurotransmitter, and dopamine is an inhibitory neurotransmitter. In case of this condition, there is loss of dopamine, which leads to more acetylcholine being able to produce more excitatory effects to the neurons in the basal ganglia, and this leads to overstimulation like tremor, rigidity, or increase in cholinergic activity. The signs and symptoms are tremor, bradykinesia, muscle rigidity, postural instability, shuffling walk, freezing of the gait, cognitive changes, depression, anxiety, sleep disorder, autonomic dysfunction, speech changes. Now the most important topic for the NCLEX, that is nursing management for the patient with Parkinson's disease. Always focus on patient safety, preventing falls, promoting mobility, assist with gait training. Ensure patient safety like moving slowly when changing position, use of handrails in bathroom, removing rungs, proper lighting, non-slip shoes. Physical therapies to improve patient quality of life, active range of motion exercise, maintain patient autonomy by helping with eating, cooking, or daily personal care, proper positioning while eating to prevent from choking, use of mobility aids like CAN, speech therapies, use of clear and concise communication, monitor for dysphagia, encourage thickened liquids, adequate hydration and nutrition, monitor for cognitive changes, reduce confusion, engage patient in social activity, and the emotional support. Okay, now let's go on medication for Parkinson's disease. Carbidopa and levodopa used in combination. Carbidopa helps to prevent levodopa from being broken down in the blood before it enters to the brain, hence more enters the brain and lessens the side effect of nausea. When levodopa enters the brain, it turns into dopamine and acts as a dopamine. And NCLEX tips to know is, do not take this medication with MAO inhibitors like monoamino oxidase inhibitor. It will lead hypertensive crisis. Plus, avoid taking high protein meal like meat, eggs. This will interfere in absorption. The another topic on neuro is myasthenia gravis. It is an autoimmune condition where the body attacks the receptor that allow for voluntary muscle control, which leads to a muscle weakness. In this condition, the mainly eyes, throat, face, arm, leg, and respiratory muscles are affected. There is progressive muscle weakness where muscle cannot contract properly, leading to fatigue, weakness in the body. And the hallmark sign is muscle weakness, which becomes worse with activity and improves after resting. This is the most important thing to know in this condition. And the other sign and symptoms are weakness, face, neck, arm, leg muscle weakness, speak and swallowing problem, choking, gagging, eyelid drooling, ptosis, double vision, expressionless or mask-like face, no energy, fatigue, short breath, respiratory muscle weakness. Okay, the most important part, that is nursing management. We need to focus on promoting patient safety, managing symptoms, preventing complications, and providing education and emotional support. Monitoring respiratory status is important, especially for sign of respiratory failure, and assess for dyspnea. Assess for neurological status, assess muscle strength, cranial nerve functions like eye movement, facial weakness, swallowing, speech problems. In severe case, respiratory support such as oxygen therapy, mechanical ventilation may be necessary. Encourage for rest, avoid overexertion as excessive activity can worsen muscle weakness. Provide assistive devices. In case swallowing difficulties, ensure the patient can swallow safely. Provide thickened liquids and soft food to prevent aspiration. MG can affect body image and quality of life, so provide adequate emotional support or family education, provide counseling or refer to a psychological support. For the medical management, anticholinesterase like pyridostigmine is used, which helps to improve the symptoms, but there is no cure. To suppress the immune system, corticosteroids, for example, prednisone, are used. In case of non-steroid immunosuppressant, azathioprine or cyclosporin are used. Plasmapheresis with administration of IV immunoglobulin are used in severe cases, which filters blood by removing antibodies that attack the receptors at the neuromuscular junction. Thymectomy is a surgical procedure which is removal of thymus gland, helps to improve some symptoms in some patients, but there is no cure. And other supportive therapies are like ventilator support in case of respiratory failure. Let's go on another topic, that is GBS. This is an autoimmune neurocondition where the immune system attacks the nerves in the peripheral nervous system and cranial nerve. In this case, the immune system attacks the myelin sheath, which disrupts the nerve signaling and leads to muscle weakness, sensory changes, and potentially paralysis. GBS can happen to any person at any age. There is currently no cure, but treatment can help decrease signs and symptoms if started within 2 weeks of symptoms. The signs and symptoms are progressive muscle weakness, paresthesia starting in the leg and often moving upward, tingling or numbness, mostly in toes and fingers, loss of reflexes, absence of deep tendon reflexes, severe cases, paralysis, including respiratory muscle, leading to respiratory failure, which requires ventilator support. Okay, now let's go on nursing interventions. Focus on monitoring for complications, providing supportive care, assisting with rehabilitation process because GVS can lead to rapid progressive paralysis, respiratory failure, so early intervention is critical. Frequent assessment of respiratory status, have airway management equipment at bedside if patient is in hospital. Evaluate their swallowing as they are risks for aspiration, management of airway, regular monitoring of respiratory status, heart rate, blood pressure. Assess for motor function regularly, monitor reflexes, monitor sensory function, regular pain assessment and pain management, proper positioning and pressure sore prevention, fluid and nutritional support, psychological support, family education, prevention of complications, measures to prevent infections, rehabilitation and mobility. Now, the medical management. Immune modulating therapies, plasma exchange or plasmapheresis, often used in patients with severe GVS. It is the process which will filter the blood to remove the antibodies from the plasma that are attacking the myelin sheath, which has to decrease signs and symptoms, but this is not the cure. Intravenous immunoglobulin IVIG, which suppress the production of harmful antibodies, and other supportive therapies like mechanical ventilation, DVT prophylaxis, anticoagulant, and compression stockings for pain management, gabapentin or pregabalin, blood pressure management. Now the next topic, that is autonomic dysreflexia, which is also known as hyperreflexia. This is potentially life-threatening condition. It is group of symptoms caused by spinal cord injury, most likely T6 or higher injury. Autonomic hyperreflexia is an exaggerated reflex response by an autonomic system. It's a medical emergency that must be prevented and quickly detected. It can lead to a seizure, stroke, and can be fatal. Anything that is an irritating stimulus that occurs below the site of spinal cord injury can lead to this condition, but there are three big causes, which are bladder issues like distended bladder or urinary tract infection, the bowel issues like hard stool collected in the rectum leading to infection, breakdown of skin due to any type of binding devices, tight clothing, pressure injury, bone infection, and the other causes might be birth process, sexual intercourse, menstruation, or any procedure that causes stimulation of below the site of injury. The signs and symptoms are severe hypertension, bradycardia, pupil dilation, blurred vision, severe headache, flushing, anxiety, sweating, pale, cool, clammy skin, nasal congestion, piloerection. If you are preparing for the NCLEX, must remember these signs and symptoms of autonomic dysreflexia because this is also the important topic for the NCLEX. You might get question on this topic. Actually, the case study type question where you will have to guess the condition and provide the nursing management for this condition. Immediate nursing management is important for this condition. First of all, we need to make sure catheter is not kinked or blocked and draining properly. If kinked, unkink immediately. If clogged, irrigate the foliage. Assess for last bowel movements, bowel sound, palpate abdomen. Remove any binding, clothing or devices, proper positioning and protect skin from injury. For the immediate management, get help from rapid response team, stay with patient, provide high follower position, check blood pressure every 2 to 5 minutes, remove any binding, clothing or devices, investigate and correct the cause. For the medical management, we use nitropest and nifedipine. Nitropest is a topical applicant which dilates the vessels and helps to decrease the BP. And the nifedipine is usually used for sublingual for immediate release, which is calcium channel blocker. Now we are at the end. Thank you for watching and do subscribe for part 2.